A shocking new study out of Northwestern medicine found that 1 out of every 2 pregnant women in America had poor heart health before they learned they were expecting. Joining us with details on this is Dr. Sadiya Khan, assistant professor of medicine and cardiology and epidemiology at Northwestern University's Feinberg School of Medicine. Thanks for joining me this morning.
Morning.
When we think about young women of childbearing age, heart health isn't necessarily something that comes to mind. What did this study find as far as what's the most common heart-related problems that these women tend to have?
We were really interested in understanding why we've seen such an increase in the number of complications during pregnancy. We know that the maternal mortality health crisis in the United States continues to be one of major concern. And one of the things that we know is that heart health risk factors coming into pregnancy can really be associated with having complications during pregnancy. In particular, we looked at having obesity, high blood pressure, and diabetes, and found that nearly 1 in 2 women had one of these risk factors before even becoming pregnant.
Wow. So what kind of impact does that have on the baby?
This is really critical, not just for the mom's health, but also for the baby. These risk factors are associated with preterm delivery, so going into labor early, which can affect the child and their health as they grow up, as well as knowing that that environment that the baby is growing in the uterus can be associated with poor heart health for decades to come into adolescence and adulthood for the child as well.
Wow. Okay, so let's talk about this because it actually gets even worse for women here in the Midwest. Why was it so bad for women in the Midwest?
That's a great question, and one that we were really disappointed to see. We did see significant differences in the Midwest and the Southern states where there was worse heart health coming into pregnancy. There may be multiple different factors for this, but important factors that we think may be related to this are diet and physical activity that may be worse off in these areas.
Okay, so what can women do right now to improve their heart health? Do you want them to undergo stress testing or even electrocardiograms before they get pregnant? What are you guys recommending after this?
Great question. The first and most important thing is to know your numbers and know your risk. Whether or not you're thinking of getting pregnant, most young women in this age range aren't thinking about their heart health, but knowing that it can be connected to something in your very immediate future in terms of pregnancy complications and outcomes, it's important to know what your weight is, know what your blood pressure is, what your diabetes risk is, so that these could be managed before becoming pregnant.
Yeah, it's so interesting because so many times women worry about taking, the proper prenatal vitamins, and now here's something critical that they should be thinking about. Dr. Sadiya Khan with Northwestern University's Feinberg School of Medicine. Thanks for joining me this morning. Interesting topic. You take care. A teen